Welcome back to Shape of the City. I'm Clover Frederick and I'm your host. One of the biggest contributors to the current obesity epidemic in our country is calories we drink. Today we will learn about a healthy beverage initiative going on right here in Lincoln from our guest Tami Frank from Partnership for Healthy Lincoln and Tonya Vhylidal from WorkWell. Thank you both for joining me.
Thanks for having us.
Well, we'll start with Tami. What exactly is the Healthy Beverage Initiative and how did it get started?
Well, it started really as kind of a public awareness campaign just to educate people to know that sugar-sweetened beverages are the #1 contributor to added sugar in the American diet. Nearly 50% of added sugar comes from sugar-sweetened beverages, which is why we focus our efforts on education around healthy beverage choices, as well as making policy, systems, and environmental change to make the healthy choice the easy choice. And there were a lot of other communities across the nation and organizations like the CDC that were promoting similar campaigns. So we adapted the Boston Public Health Commission's stoplight approach, which is where we came up with our Rethink Your Drink campaign. And we've really found that the red, yellow, and green categories are easily understood across age groups and also across different languages. So red being those that have obviously the highest sugar content, yellow are reduced or no calorie beverages but often contain artificial sweeteners, and then green being the healthiest beverages, with water being obviously the best choice.
Okay, now what are some simple things a viewer can do to drink healthy beverages or even encourage youth to drink healthier beverages?
You can start by swapping one pop or energy drink per day for water. One 20-ounce soda contains 240 calories, which is about 25 pounds a year. So that's one simple change. To encourage youth really is to change their environment is a big portion of it. If you don't have pop or energy drinks in your home, they'll choose something else. And then also just being a role model. They're paying attention to their parents and teachers and what they're drinking.
Okay. Now what have been some of the biggest challenges of the initiative?
Probably the biggest challenge is that with any public awareness campaign, I suppose, is that there are a multitude of ads promoting sugar-sweetened beverages, and with limited resources, it's hard to compete with those, with all those messages. I think from a worksite perspective that Tonya can talk to a little bit too is that while businesses want their employees to be healthy and they want to provide a healthy environment, they have a lot of other things going on that compete with that, and so it's really, I think, finding the right time for them to approach change in their business.
Okay, now how effective has the initiative been? Do you have some success stories you can share?
Yeah, we've had a lot of successes over the 3 years that we've been doing this. This is actually, I think, the 4th version of our board. You should have seen the first one. It was cellophane and foam core and whatnot. But really, we piloted kind of the Rethink Your Drink concept in 3 Lincoln organizations: Lincoln Industries, CHI St. Elizabeth's, and a Surety Life Insurance Company. And while they were already dedicated to providing a culture of wellness for their employees, they reported back that this just helped take them to the next level. CHI St. Elizabeth's actually took out all of they were providing free sugar-sweetened beverages on every floor to patients and families, staff, that kind of thing. And just by taking that out, they saved $27,000 in the first year, so they found an added benefit to that as well. And then as far as other organizations throughout the community, we partner with over 20 community organizations, and they share the healthy beverage message with their clients and staff, students. And for instance, the Malone Community Center took out vending machines out of their center, and now they serve healthy food and beverage options to their kids in the after-school and summer setting. And the kids enjoy it because they get to be a part of the preparation and planning for it.
Great. Now let's talk to Tonya for a bit. What is being done in the workplace setting?
Sure. We have, all of the WorkWell members, there's about 106 members, have access to the toolkit. And we have had multiple focus groups, we've had meetings, we've had one-on-one interactions with many of our businesses. The board itself is incredibly popular. It's made its way to at least 10 businesses already, and it has been taken to several health fairs. So from a education and awareness standpoint, there's been much done with the businesses. Implementation of some of the toolkit practices and the policies and things like that, we're just really getting that initiated now. And we'll have more to tell on that probably in the next 6 months.
Very good. What are some of the challenges you found in getting businesses on board?
As Tami spoke about earlier, it's just that there are so many different things going on that many of the businesses find that the time demand or having the time to do what they want to do and do it well has been more of the issue. From, like I said before, the education and awareness and actually having the board around and using it as a way to demonstrate what's happening with sugar-sweetened beverages has been wonderful, but the actual making the changes, implementing policy systems and environments is a little more challenging. Once we get into the fall, where it slows down a little bit, I think we'll see more activity.
Okay, very good. Tell us about some of the successes that the current businesses who are using this initiative have found.
We have one company in particular, a smaller organization of about 25 or smaller, they have about 23 people, has big use of their Pepsi machine, and Mountain Dew is the favorite drink of that population. So just the education alone, it hasn't completely erased them of getting Mountain Dew out of the machine. What it has done is it's reduced the amount that has been taken out of the machine. And then the organization also is supplemented by providing free water. There's water that's free in the refrigerator, and that has been a huge fan favorite with their employees. So just like she said, making small changes, you know, bringing the water in that we added, and it made a small change to the environment, and they love that. And therefore they're drinking less soda. So that's been a key change.
What would you tell a business that's sort of on the fence about starting this initiative?
Yeah, I would just say, just get educated. Give us a call. Find out what it's about. You know, do a little research, get on the Partnership for Healthy Lincoln website, look at the toolkit. Maybe even ask us to come out with a board. Give us the opportunity to just show you and demonstrate what it is. And then let's sit down and have a discussion. We're going to meet you where you're at. Nobody's going to force anything on you. It's all about supporting you and guiding you and helping. That's really the key thing.
Very good. Now, if there is a business that's interested in learning more, how do they get started?
If they want to have support at the work site, you're going to reach out to Nicole Osborne, who is our Healthy Choices Coordinator, and she can be reached at 402-483-2511, extension 102.
Very good. Now let's jump back to Tami for a minute. Well, now explain this board to us.
Okay, so as we talked about, the red beverages are those that have the most sugar, and some things that people don't necessarily think of, they obviously, you know, recognize pop or maybe even energy drinks as something that has a lot of sugar. One that always gets people, for instance, the Frappuccino, you have to walk 4 miles to burn that off. The Gatorades, people think, and parents, well-intentioned, think that, you know, their kid's been out playing for 30 minutes, you know, that they've got to have a Gatorade to replenish those electrolytes, when really in most cases water is all they really need. If you're out running a marathon, or you're, you know, in the middle of July when it's really, you're really pouring the sweat on, you know, then Gatorade's appropriate. It has its place, but most of the time water will do. Another one is the juice drinks. It's important for parents to, when they're buying juice, to really look at 100% juice. A lot of drinks have 10% and they call it juice. But even with 100% juice, as you see in the yellow category, that's a tiny 4-ounce bottle. And so you don't a lot of time get juice in that. And when you go much larger than that, really you're in the red category, because there's a lot of sugar even in 100% juice. So we always tell parents, really it's better just to give them the fruit than the fruit juice if you're going to make a choice there. So obviously in the green category, water is the best choice. There's unsweetened tea, black coffee. Those are also beverages that are good to go anytime.
Okay, very good. Now tell me what you're doing to promote this project.
Okay, so we've taken this board out to wellness fairs, community events, after-school programs, and whatnot, just to raise awareness. People see it and they either really relate with the amount of sugar that's in there or how far they have to walk to burn it off. So it's been a really effective tool in letting people know healthy beverage options are available. We also, you might see some billboards that we have around town that tell how far you have to walk to burn off some of these popular beverages. And you'll see that maybe throughout the summer. We're going to also do some bus ads as well. And then with the guide for work sites, there's a lot of promotional materials in there that work sites, anybody can print off. They can put their own logo on it, really customize it to them. There's a brochure, table tents,
Signs.
Yep, other things.
all there.
That,
Okay. And what else are you promoting in the future?
One thing that we're integrating into kind of the healthy beverage choices is your first healthy beverage, and that's breast milk. The AAP recommends that infants are exclusively breastfed for the first 6 months of life. And what we found is that in Lincoln, 90% of moms intend to breastfeed. And Nebraska is the 5th highest in the nation for the number of moms returning to work. We have about 77% of moms returning to work. And that's how it comes back to the work site then, because we find we have this great initiation rate, but then unfortunately it trickles off, especially around return to work time. So that's something that we've just started with WorkWell to talk about how we can provide support and lactation support services for businesses to let them know how they can be supportive of moms to reach that goal.
We actually have a collective meeting this week regarding that to get a better understanding from mothers, businesses, the hospitals on what's going on and how can we break down those barriers. So we're excited about that.
Good. Now, if there are individuals interested in learning more about this initiative, how can they do that?
They can go to our website. It's healthylincoln.org, and they can download the guide, which is really really short. Most of the resources in there are just that. They're resources and tools to help businesses once they decide that they want to do something about that. And they can also check a board similar to this out through WorkWell.
There's even a brochure that's inside that guide. That's nice. And pop-up tents.
Yeah.
So
Lots
there's
of promotional materials in there that they can print off and really adapt.
Yep.
Put their logo on. We're open to sharing that with anybody.
Great, that's wonderful. Well, thank you both for coming today. I appreciate it.
Thank you.
Now, stay tuned. When we come back, we're going to hear about some healthy hydration options.